As part of the Knowledge Now series in collaboration with the Royal University of Bhutan, Talking Matters this week features Janet Schofield, Senior Advisor and Professor at the Royal Thimphu College. Janet is Chair of the Social Psychology Program and a Senior Scientist at the Learning Research and Development Center at the University of Pittsburgh. Today, she talks about social psychology and youth with specific focus on Bhutan. We're discussing social psychology and youth. Why would you club these two together, actually?
Well, I think the reason to think of them in the same breath is that youth are very, very interested, very influenced by the social environments in which they live. And social psychology is the study of the way in which individuals interact with the environment in which they're found. So it studies how individuals affect the environment and how the environment affect individuals. And since youth are so much affected by their peer environment, by their school environment, by their family environment, and also by the broader cultural environment in which they live, it makes sense to basically think of them together.
And this relationship can actually be exploited to actually work out to be positive for youth as well.
That's right. If you think of ways to structure the environment that support positive behaviors and also ways to structure the environment that minimize negative behaviors, then you can create an environment that basically helps to move youth in the direction that's healthy for them and healthy for the society as well.
You've actually done this practically here at the college, Royal Thimphu College.
Yes, that's right. One thing we've been doing this year, which very much reflects this idea, is a campaign called Living Free without tobacco or drugs. And what the college has done is to try to create an environment which will encourage healthy behavior on the part of the students in these areas. So, for example, we've done an awareness campaign with all sorts of posters and skits and those kinds of things. But we've also asked ourselves how else to structure the environment to go beyond awareness to actually try to shape students' behavior. So, for example, at the beginning of the campaign, one of the things the college management did was to just look at our rules and regulations and, even more importantly, at the enforcement of those rules and regulations and ask how can we create an environment which actually, even more than we have in the past, discourages these behaviors. So they started, for example, actually having staff go around and monitor the areas where we'd had some smoking before in spite of the college's efforts to prohibit that. And that monitoring, at least from reports from the students and staff, seems to have actually had some impact on reducing smoking in those areas.
How do you see yourself actually sharing this with other educational institutions? Because you're telling me from what you've carried out here at the Royal Thimphu College, it has proved to be successful. So then how are you planning on sharing it? Are you even planning on sharing it?
Well, I guess I have two responses to that. The first is that we have yet to be sure that it's completely successful. That is, I did say, and it's the case, that I've had students and staff say there's clearly less smoking in these areas. But one of the things we're doing, and partly because there is this influence of social psychology in the work that we're doing here, is actually developing ways, and we've already started that, to measure the impact of the campaign. So, for example, although it may sound a little strange, we actually had people counting the cigarette butts in various areas where smoking had been common in spite of our efforts to minimize it. And they counted them at the beginning of the campaign, and just last week I got the data from the end of the semester. I haven't had a chance to analyze it yet. So we'll be actually looking for hard evidence to support our kind of sense that it's actually working. Now, assuming that it is working, assuming that the evidence suggests that, once we've kind of really looked at it carefully, then we'll be doing a number of things. The first is that I have written a report on the results of the campaign, And our plan is to try to circulate that to relevant colleges and also to any ministries that might be interested. For example, the Ministry of Health or the Ministry of Education. An interview like this may also help to let people know about the campaign and its results and some of the ideas that are coming out of it. So that can be very useful as well. So once we know we really have something to share, then we'll work very hard on finding ways to make the best use of that information.
We're talking about how social psychology can actually help combat youth problems, but then you're also saying that the term youth problems is misleading.
Yeah, the reason I had mentioned that the term youth problems may be a little bit misleading is that what social psychology highlights is that individuals are very, very affected by the environment in which they live. So though we think of things like drug use or excessive alcohol use or perhaps unemployment as youth problems, gang violence as youth problems, and to some extent that's true, those problems reflect not only the individual youth themselves, but the kinds of experiences that those youth have and the way in which the environment shapes their behavior. So, for example, the Voices of Youth publication from the Center for Bhutan Studies suggests that parental divorce is a very major cause of youth problems. And so if we think of it as just a youth problem, we're missing the fact that the family environment in which those youth live may really contribute to that problem. Similarly, I think there was a recent study that showed that self-reported alcohol use among youth was related to alcohol problems in the family, in their parents. And so again, we might say this is a youth problem, the youth is drinking too much, but in fact, the reason for that drinking may be connected to patterns they've learned in the family. The same study showed that a third of the male secondary students in the country reported having been abused in some way by individuals, adults, under the influence of alcohol. That kind of experience may then lead them to gangs, looking for support, looking for others who they can connect with when they resent perhaps the behavior that they've experienced at the hands of adults. So I think we need to recognize that while people have to take responsibility for their own behavior, and in that sense youth problems are youth problems, if we want to tackle youth problems, if we want to prevent them, if we want to minimize them, we may need to ask about the environment in which youth find themselves and how we can make sure that those environments support their healthy development.
But would you say that this is really a big problem? This should be a big concern for everybody in Bhutan?
I think in any country, youth problems are really important, and especially in Bhutan, again, as I mentioned, because of the proportion of the population that's young. I also think that Bhutan is going through such vast change and will probably continue to go through really major change in the next 10 to 20 years, that it makes youth problems something of special urgency. Because when a society's been functioning for a long time in a particular way, and then there's big changes that come, it's harder often for youth to get guidance from adults. The world has changed enough that the world that adults knew is not quite the one that the youth are going to be facing. And so there are some specifics about the nation and the position that it's in at this moment that make these youth problems especially important.
And also because your background in social psychology now, and the fact that I've met quite a few recovering addicts who've had problems either with alcohol abuse or with drugs, narcotics that is, who say actually that saying no to something actually doesn't work. So there needs to be a different way of getting this message home. Do you also belong to that school of thought now? Because I mean, you can still argue about it in favor of it and not in favor of it as well. But then they've been through the process themselves. And so they say that, no, you know, say no to drugs or say no to alcohol will not work. What do you have to say to that?
Well, that phrase, say no to drugs, if I'm not mistaken, actually comes from what was called the DARE campaign in the US. It's a very big campaign in many, many schools, and the studies of it show that it actually wasn't very successful. In fact, it really wasn't successful at all. So I think it's probably too simple. Just say no is very simple. There was one study done here that asked youth, who influences you the most? And 20% roughly said friends, 20% said parents, and 20% said teachers. That same study also found that 60% of the youth in grades 12 through 9 through 12, knew someone who was using cannabis or alcohol or solvents. So if you have a lot of students influenced by their peers and a very high proportion of peers using these substances, then it becomes very hard for youth just to say no. In fact, when we asked in our survey what were the two biggest reasons why students started either tobacco or drug use, the answers were very, very similar. The two most frequently mentioned reasons were my friends encouraged it, and I was bored. Those are very interesting reasons, especially in an environment where so many students say they're really interested. As many students say they're influenced by their friends as by their parents or by their teachers. So I think we need to think perhaps of other ways to encourage students not to get involved in these behaviors, and if they do get involved, other ways to help them stop. And social support is really, really important in that area. Also, education is important. There was one study that asked students, I believe this was the Bhutan, the Global Youth Tobacco Survey here in Bhutan, and it asked students if they had learned anything about the harms of tobacco use in school. And it was about 58% who said yes, they had heard something about it in the last year. But the other, more than a third, said no, they hadn't been told anything about it in school. And this is especially important because children start smoking or using drugs often extremely early. In our study, what we found was of those who use tobacco here at RTC, 50% started before they were in 11th and 12th standard. 24% started before they were in the 8th standard. And then another 26% in 9 and 10. And so before they got to college, the vast majority of students who end up smoking or using drugs were already doing it. And so if 25% of smokers or drug users start using in the 8th standard or earlier, then this kind of education needs to start very, very early to help students realize the dangers. Because once they start, things like tobacco and drug have actually physically addictive properties, so stopping is very, very difficult often.
We're speaking of education here, which I find a little academic. Now, because you come from a social psychology background, how can you, I mean, yes, so far in the conversation we've had, we've talked about how social psychology can be used in a preventive manner.
Maybe we had different things in mind when you speak of education. One probably the most common thing that would come to mind when you speak of education here is an awareness campaign. Something simple where you have signs and kind of basically try to encourage people not to engage in a behavior that you don't want to have happen. And that's a good start. But another part of education can be much more practical and in fact based much more on social psychological principles. For example, one thing you can do is to actually work with children to help them practice what they will do in a situation where their friends are encouraging them to use drugs or tobacco. And so you have a role play and a friend is saying, oh, come on, try it, you know, don't be a coward, it's great. What does the student say in that situation, which will let them feel free to essentially protect their health while not alienating the friend, while not feeling as if somehow they're not as adventurous or as daring as their friends are. And so actually providing students with behavioral practice about how to handle some of these situations is a good example of something derived from social psychology, which could be incorporated in education programs and would go beyond simply a slogan like just say no, or even useful health information or related information about the negative consequences of using these substances.
When we speak of negotiation, then I mean another area, another youth problem, I would say, because I mean it affects a lot of young girls. Maybe not the boys directly, but of course they play a very active role in this problem as well. Teenage pregnancies. The fact that we do not have enough sex education, that even talking about sex is a taboo in a society. But then if you think about it, there is a need for it. Then, I mean, this negotiation, learning to say no, like learning to say no to drugs and alcohol.
Right. Actually, the way you discuss that is a perfect example of my point earlier about social psychology. We might think of a young girl who gets pregnant in an unwanted way as a youth problem. But on the other hand, if that experience comes from being in an environment where she's been given no information about sex or no tools to figure out how to negotiate a request from someone if she's not interested in having sex, but she's being pressured by either a peer or by someone in her neighborhood or the like, then in fact it's not only a youth problem, it's a societal problem. So I think one issue that is very important for youth is that they essentially understand their sexuality, they understand how to protect themselves from getting pregnant, and they understand how to say no if and when that's appropriate, as it often is when youth are very young. So I think this is another really good example of the importance of giving people practice in learning how to do things, how to say no, as well as just kind of providing them with a slogan or a general societal expectation that they won't have sex until a certain age.
Since you're pointing out how peer pressure is such a strong influence in dictating if somebody gets addicted, tries out a new substance or not, do you also see a same peer group actually influencing young people in a positive manner, then they could actually play a positive role then?
Well, it's interesting you asked that question because we've been trying to incorporate that as part of our campaign here at RTC. One of the things that we did in the survey was to ask students whether they like having others smoke on campus, and about 70%, maybe more, said no, they don't. Okay? We then asked them, well, have you ever asked another student not to smoke? Reminding them that it's against the college rules, that it's against the national law, or just politely saying, sorry, please, don't smoke here. And a very small percentage of students had ever done that. Now, there's a reason for that. It's a little awkward. The social norms, basically, may not be promotive of that kind of behavior. So what we decided was that we should try to help students see that if they do it in a respectful and courteous way, it's perfectly reasonable for them to ask someone not to smoke. Everyone knows the dangers of secondhand smoke are there, and so in fact the smoker is not just exercising some right, which they actually may not have if they've bought their cigarettes illegally, but they're not exercising a personal decision to smoke, but they're actually creating an environment which influences other people's health. So what we've done when we did this survey, and we found that so many of the students didn't like others smoking, was to make that we put up all sorts of signs indicating that. We actually made up signs that said, encourage students to ask others not to smoke, and to said that everyone on campus has the right to ask others not to smoke, since it's not consistent with the college regulations and the law about colleges being non-smoking zones or schools being non-smoking zones. So we're trying to use peer pressure, peer encouragement. It's not easy because norms are very slow to change, but there's actually some fascinating work that's been done that shows that at least in other cultures this can work. And we'll have to see whether it works in the Bhutanese culture. In the US, one major problem is excessive drinking among college students, a major youth problem. And one of the things that social psychologists found was that when first-year students enter college, many of them start to drink a lot because they think that's what college students do. That's how you fit in. And so they then began to gather data on the actual drinking behavior of students, and they found that many of the entering students actually overestimate the frequency with which other students drink and the amount that they drink. Maybe because when people drink a lot, they often behave in ways that make themselves very obvious. You know, they may be very noisy, they may be aggressive, and so they kind of stand out. So what these programs have done is to actually just pass on accurate information about the frequency of drinking, about the amount of drinking that occurs on campuses. And there have been any number of studies that show that what that often does is to actually reduce the drinking on the part of the entering students, because they realize then that in their effort to fit in, they've actually been overdoing it, and they don't need to drink huge amounts in order to be a college student, in order to fit in. And when I saw the results of that study of drinking at Gaidu, which got quite a bit of publicity maybe 6 months ago or some time ago, it made me wonder whether there are ways in which a similar sort of normative approach, setting what is the norm and what should be the norm, might potentially be useful here.
Before we began this interview, you were telling me how social psychology actually plays an instrumental role in how policies are devised and also certain rules and how they're implemented. But you were also highlighting how it's important that there must be a follow-up to see whether the right intent actually justifies the length of the implementation of a policy.
Yes, there's a very famous paper that was written by a social psychologist, Donald Campbell, where he made the point that when you implement policies or programs to try to solve a problem, it's very important to follow up with actual research to see whether or not that policy or that program has its intended effect. Even policies that are developed with the best of intentions and with careful thought don't always work the way they're intended, and there certainly have been cases where the outcomes are even opposite of what was intended.
I can highlight certain cases here in Bhutan as well, yes.
So it's very important when you set in place a policy or a program that deals with a crucial issue, to ask yourself, how can we judge whether this policy or program is accomplishing the goals that it's intended to accomplish? And social psychological research methods, especially something called quasi-experimental methods, provide really good ways of doing that, of helping you gather data to see whether or not the goal of whatever your policy or program is met. So I think one reason that people sometimes give for not doing this is that it takes time and it costs money. But how much more time and how much more money is actually spent if you implement a program broadly and it doesn't meet the goals that it was intended to meet? So even though there is this effort that you have to put in to decide whether a policy is meeting its goal, I think it's a very important thing to do, and we do have quite a few methods that are appropriate in various situations that allow this to be undertaken before policies are implemented on a really broad scale.
This calls for involvement at all levels.
I think so, very much.
But thank you so much, Madam Janet. It was lovely having you on Talking Matters, and for you to have highlighted where we can go, what we shouldn't be doing, and what we should be doing. Thank you so much.
It's been my pleasure. Thank you.